walking, which is so important, and I don't want to knock walking. I think walking is absolutely amazing, and breast cancer patients should be walking, but I'm looking at the information that's out there telling patients to walk and not telling patients what should come first, and that's shoulder mobility. So I want to set the record straight, and my vlog is going to let you know the 5 reasons that you really need to make sure your shoulders are moving before you walk. There's a difference between exercise and rehab, and I don't know if that comes across, because I started looking at some sites just before I came on here to say, when breast cancer patients are looking online, they're home from surgery and they're wondering what they should do, and they have that little pamphlet and they look online to see, well, what exercises should I do? What's the difference between exercise and rehab? So if we think about it in the context of, let's say, somebody who's gone in for back surgery. So they have a job where they could be a security guard and they're walking all night or all day. So after back surgery, do we say, hey, you can go back to work? It's just walking, it's fine, go back to work. That sounds kind of funny, doesn't it? Or, well, I've had 5 shoulder surgeries. So I look at my shoulder surgeries and my surgeon wouldn't say to me, hey, yeah, go back to the gym, grab those weights, you know, start working out, you know, go back with your patients, you're fine to lift legs and move limbs and do all that stuff. No, you need rehab first. But I think the words get mixed up a little bit between rehab and exercise, because if I'm looking on here and I'm on a few sites and just seeing the kind of information that breast cancer patients would be getting if they're looking at it, this is a very popular cancer center that is definitely saying about doing gentle exercises after surgery, but they're not saying what. So gentle exercises are a safe way to begin moving your body after surgery. I mean, it's not telling you what to do for that. So it's leaving patients not having a step-by-step guide. If I Google and just do a Google search and put breast cancer and exercise, the first thing that's coming up is telling me about the 150 minutes of walking. Well, yes, again, walking's awesome, but I don't know if I want you doing that the day after surgery. So there again lies the issue with a lot of information out there, but nothing step-by-step. If I go to breastcancer.org, it's explaining the differences in exercise, which is great. So aerobic exercises, flexibility exercises, strength and resistance exercises, but it's not telling me when to do what. And the only thing it's telling me after breast cancer surgery is that I should be careful doing weights because I may develop lymphedema. So again, I want to make sure that we know rehabilitation after surgery is really important. One last thing, if you do take a look, there is some information that is telling us on the American Cancer Society about general guidelines, that you will have some tightness, that you will have some pain, that you may have burning, tingling, and numbness. So this is defining some of the issues that may occur after surgery. And we're looking at the exercises. There is some that you may want to try that are on here, but again, I've talked to you really specifically about the foundational movements, and those are those 6 shoulder movements that you need to work on. So if I look at these exercises and I look at things such as, let's say, side bends, well, the side bends, that's great to stretch the sides of your body, but they have my arms, and I don't think you can see, I'm looking in here, the camera picture, arms are way up here, and this is right after surgery. I don't know how many patients, some maybe can, but your surgeon may not even let you move past 90 degrees. And so 90 degrees right at this shoulder level. If I take the 2 hands and I bring them right up and you see elbows beside my head, that may not be something I want my breast cancer patients to do right after surgery. I want you to get moving. I want you to do it well, and I want you out there walking. Your shoulders should be moving first. I want you to start with a rehabilitation program. When you see the things about exercise, yes, fantastic, but don't feel the pressure to have to do this right away, okay? Send me an email, send me a DM. let me know, but follow the guidelines from your surgeon and move slowly, work your way up. Don't look at that 150 minutes as something you have to do tomorrow. So, have an awesome afternoon.